Hello everyone. In this video we are going to discuss about biomedical instrumentation. In biomedical instrumentation we are going to discuss about ECG signal. So ECG stands for electrocardiography. ECG stands for electrocardiography. As the name indicates cardio, it is going to measure the electrical activity of the heart. So it is going to measure the electrical activity of the heart. So the electrical activity of the heart could be measured by a biological signal which is called as ECG, which is electrocardiograph. So this is how the electrode has been applied while taking an ECG measurement. So the skin has to be properly washed and it should be cleaned, and it has to be rubbed in such a way that the dead cells have been removed, and then the disposable electrode has been placed on the surface of the skin, and the other end it has been connected to the lead wire via which the ECG signals could be transferred and it could be measured. So the 12 lead system or the electrode systems which has been used to measure the ECG signals. So bipolar limb leads or standard leads, which is of three types, augmented unipolar limb leads, which is of three types, and just leads of six types. So totally there are 12 lead system which has been used to measure the ECG signals. So let us see each and every topic in detail now. So first is bipolar limb leads. So it is also called as Ethiovan lead system. So the right arm in this diagram is going to be determined as RA, left arm will be determined as LA, right leg will be determined as RL, and left leg will be determined as LL. So from all these things, the potential will be recorded, whose potential will be given by the difference between the generated potential between the two electrodes. So among this, the right leg is always taken as to be the reference electrode, which is taken as to be the ground electrode. So along with any one of these electrodes, and the right leg gives us the lead 1, lead 2 or lead 3 systems. So let us see this with an example. So this is the right arm, this is the left arm, and this is right leg, and this is the left leg. So for left leg, red color lead is always used. For right leg, green color lead is used. And for right arm, white color lead. And for left arm, black color lead will be used. So to measure the chest electrodes, brown color lead will be used. So let us see the limb systems in detail. This is the standard lead one. So always the right leg will be connected as to be the reference. When it is taken across your right arm and left arm, it is given as to the positive potential of an op amp, and the right leg is given as the reference. It is given as to be the standard lead system. When the potential is being measured between the right arm and the left leg, whereas the right leg is taken as to be the reference, it is called as lead 2. And similarly for the lead 3, left arm, left leg, and finally the right leg is taken as to be the reference. So this is called as to be the lead 3 systems. So these three forms are bipolar limb leads. These are the corresponding waveforms for lead 1, lead 2, and lead 3. Next type is augmented unipolar systems. So now along with the same asset of the Ethiovan lead system, here two equal and large resistors have been used, which has been connected along with the limb electrodes, and it is again connected to the resistors. So here the same asset of your lead one. So here right leg is taken as to be the reference, and left arm and left leg is connected to a pair of resistors, and it is given to the one of the terminal, and right arm is given to the other terminal. This is augmented AVR, augmented lead systems. So next is augmented left systems, whereas for the left it will be taken across the right potentials. If it is left, right arm, right leg are connected to a resistors, and right leg will be connected to the references. Next type is going to be the augmented AVF. whereas right arm, left arm will be connected to a reference. It has been connected through a resistors and it is connected to the negative terminal, and right leg will be connected as the reference. These three forms the augmented lead systems. This is the Etoven triangle. Right arm, left arm, lead 1, left arm, left leg, lead 3, right arm, left leg is lead 2. Always right leg will be taken as to be the reference electrode. This is a simple picture which depicts how the lead 1, lead 2, lead 3 are connected, and this is augmented AVL, AVR, and AVF. And finally, the six pairs of chest leads which will be placed across the chest for the chest electrode. So the chest electrode which has the six potentials V1, V2, V3, V4, V5 and V6, where V1 is measured across the intercostal system of your right sternum. Fourth is going to be the V2 is going to be along the left of the sternum. V3 connected between V2 and V4, and V4 is nothing but mid vascular line, and V5 will be the axillary line, and V6 will be the mid axillary line. So there are totally six electrodes which will be placed across the chest apart from the bipolar and the augmented lead systems. So these six are called as to be the chest electrode. So there are totally 12 lead systems, 3 for bipolar, 3 for augmented, and 6 chest lead systems to measure the ECG signals. Thank you.